All right, everyone. We are here again with Dr. Tamar. How you doing?
Doing fine, young man.
I'm Juwan Young. I'm the host, and today we're going to be talking about different qualifications that would pretty much qualify you to get your medical card. So let's go over a few of those. We have the first one we have is PTSD and anxiety. So that would be the first one on the list today. Dr. Tamar, what do you kind of want to dive into with PTSD?
Well, as I mentioned before, we all have some degree of PTSD. Any traumatic event in our lives, whether it be physical, emotional, mental, spiritual, any trauma, and we all have some degree of PTSD. And I've even thought about the fact that as a general surgeon, I have some degree of PTSD given the things I've seen in my lifetime as a surgeon.
Yeah, I bet.
And so, anxiety, depression, and insomnia, inability to sleep. That's what characterizes PTSD. And all of us, as I said, have some degree of PTSD. When I talk about PTSD, I also have to talk about chronic pain, because chronic pain is all part of not being able to sleep. And if you can't sleep, you don't get the adequate rest, and it affects your memory, emotions, and mood, especially the amygdala and hippocampus part of the brain, where memory, emotions, and mood is processed. And if you don't sleep, it affects your memory, emotions, and mood. So these patients are in chronic pain,
And anxiety.
which prevents them from getting to sleep and increases anxiety and depression. So that's why when you talk about PTSD, you have to tie in the cause for the PTSD. Chronic pain is one of them.
Right.
It's one of the features that keep people from going to sleep. So cannabis, that's one of the qualifying conditions, as well as any condition that is chronic or significant pain. Fibromyalgia, migraines, rheumatoid arthritis, cancers, of course. All these autoimmune diseases where we are making antibodies against our own tissue. That's why Crohn's
Cause of pain.
and also colitis are in the category for chronic pain, because it's your immune system that needs to be addressed. You have to suppress the inflammation. That's how it works, by suppressing the oxidation and inflammatory damage, which explains the source of all pain is inflammation. And so one of the things that we talk about as the indications for cannabis therapy, it includes also some neurological disorders such as Parkinson's disease and amyotrophic lateral sclerosis, or Lou Gehrig's disease. Both those diseases are a degenerative neurological disease where there is damage to the nerves, damage to the neurons, and the patients have muscle weakness, spasms, atrophy, difficulty breathing, because breathing takes muscle signals to contract, and these patients get so weak and their muscles continue to atrophy and they die. So Parkinson's, amyotrophic lateral sclerosis is one of the universal indications. When I say universal, throughout the country, most states have that on the list of qualifications. Epilepsy is another big one. I don't know if you remember, but about 10 years ago, Sanjay Gupta did a story about a child that had epilepsy, and they tried all the different options. Their child was left a zombie, having 100 seizures a week. Once they started cannabis therapy, it went down to 10 seizures per week. And back in the 1980s, Dr. Raphael Mechoulam, the godfather of cannabis research, submitted a paper touting the benefit of cannabis in treating epilepsy back in the 80s. But his work was buried and hidden. But now, one of the indications in all states that have a list, epilepsy is on that list. Epilepsy and seizures, convulsions they call, depending on what cause. So that's one of the indications. We all can qualify one way or another, because most of us, especially at a certain age, there's anxiety, depression. We're in a pandemic. There's a lot of uncertainty about the future. Right. That alone, the uncertainty of the unknown, the fear, causes higher anxiety and depression.
That's true.
And clearly, with the adjustment that we've had to make unprecedented for this pandemic. Lots of people are anxious and depressed.
Yeah.
And anxiety and depression is something that cannabis can easily address.
Yeah.
And help us handle. But all the conditions that are on this list, I would venture that everyone has one of these conditions in their life.
Yeah, because I've seen on the news there is a post-COVID anxiety epidemic going on.
Yes, of course.
And so that COVID really did
Clearly
a number on a lot of
it says, we are social animals. All living things are social beings, social organisms, and we've had to cut off our social ties. And this has been a tremendous adjustment, and there's a lot of anxiety, depression, economic uncertainty, a lot of uncertainty about the future. And that's why cannabis is so valuable at this time, to help people deal with the present as we consider what the future holds. But there is no question that cannabis works for all these different conditions, because, as I've said before, for over 12,000 years, cannabis has been used for these same conditions which ancient cultures suffered from.
Right.
The same things ancient cultures suffer from. So, and they use cannabis all over the world on every continent for these same conditions. And I would say that, when it comes to cannabis therapy, sleep is the most important part of wellness. Getting adequate sleep can let your system rest, renew, repair, regenerate. We make new brain cells when we sleep, well into our 90s. And sleep is the easiest thing to fix, because give you some inhalation and some gummies, you will fall asleep. But at the same time, sleep can be the most difficult thing to obtain, because you have to get anxiety, depression, and pain under control in order to have adequate sleep.
That's what cannabis does.
Yes. And so clearly, PTSD, ADD, ADHD, bipolar disease, panic attacks, social anxiety, these terpenes are neuroprotective, Alzheimer's, dementia, because pain is inflammation, cancer is inflammation, disease is inflammation. All diseases, all disabilities, all deterioration and erosion is due to inflammation and oxidative damage, and cannabis slows down the slow burn, the oxidative damage and inflammation that gets us all in the end. And that's why anybody, believe me, can qualify if they need to. Because all of us have either that, or we have this in our family. And that's one of the reasons I use cannabis, because I have Alzheimer's in my family. I have MS in my family. Congenital cancer. My father had prostate cancer and rectal cancer. And I have diabetes in my family. And so, how does diabetes qualify? They have neuropathy, chronic pain. So a diabetic will qualify. They have gastroparesis, paralysis of the stomach. They have kidney disease, they have heart disease, so clearly they qualify.
And cannabis regulates blood sugar.
Yes, THCV decreases glucose intolerance and increases insulin sensitivity. That's how THCV lowers the blood sugar, while CBG lowers the blood pressure, which contribute to disease. Diabetes and hypertension is one of the biggest killers in the African American community, certainly, but all over the world. But the point we're trying to make here is that whether you have these diseases, and if you don't, if it's in your family, you want to do a preemptive strike. You want to address your genetic predisposition to these illnesses, because clearly there are genetic and outside forces that determine disease. Clearly our food, our air, and our water is contaminated, but there are genetic causes, and then causes from environmental factors. That's what I'm looking for.
Yeah.
So you gotta use cannabis appropriately, and there are different doses, different strains, different terpenes for these conditions. The same terpenes for cancer are different from the terpenes for diabetes, which are different from the terpenes for brain function, which are different from the ones from sleep, which are different from the ones for improved respiration and appetite control, nausea control, etc., etc. That's the beauty of this plant, because all these qualifications is in us or in our families somewhere along the line.
So anxiety, you went through bipolar and panic attacks. So those are pretty much they're just like anxiety. So those also qualify, a patient.
Yes. If you look at the terpenes for stress relief and brain function, that combination of terpenes, it addresses anxiety, depression, focus, recall, memory, attention span, concentration, creativity, helps protect the brain. These are the terpenes that help with traumatic brain injury, CTE, chronic traumatic encephalopathy in football players, dementia. And as I've discussed before, my mother, her mother, and her sister all succumbed to Alzheimer's. And my father succumbed to colorectal cancer, but he had prostate cancer at age 58. So I'm doing the preemptive strike to address my genetic predisposition. And that's, like, as I said, even if you may not have any of these conditions, clearly there's someone in your family that has of these 11 or 12 conditions that you would qualify for.
So anxiety, we went through the ones that are like anxiety, glaucoma, maybe any eye disease, cataracts.
The Egyptians documented the use of cannabis to treat glaucoma, and what it was found back then, which is displayed now, cannabis decreases the intraoptic pressure. When people use cannabis to treat glaucoma, they should stick with their Western approach, meaning the standard approach that ophthalmologists recommend, but they should add cannabis to the regimen, because cannabis lowers the intraoptic pressure.
Right.
And I've had one patient that had glaucoma, and he related to me that one of the symptoms of his glaucoma is loss of his peripheral vision.
Right.
It's called bilateral hemianopsia. He can't see his peripheral borders. And he told me that the loss of his peripheral vision was diminished. The progress of the disease was limited, slowed down when he started using cannabis. So it didn't cure him, but it improved his quality of life by slowing down the deterioration of his peripheral vision.
Glaucoma, I know glaucoma is, pretty much related to the eyes. So I know some certain kind of eye diseases probably could qualify a person. Maybe if you have eye injury, it could probably help with the pain.
If you have pain, if you have eye injury, you have pain.
Definitely.
That's going to qualify. If you have an infection, inflammation, that's going to qualify, because all disease, all injury, all deterioration, everything that goes wrong with us is due to inflammatory changes.
So HIV and AIDS, are there any other diseases that are similar to it in the way that it works?
Well, there are bacteria, but we know that cannabis is anti-inflammatory, antibacterial, antifungal. We know that people on cannabis therapy tolerated COVID infections better and had protection from further COVID infections on cannabis therapy, so it works for viruses. Clearly, we know that fungi and bacteria, cannabis is being studied to treat something called MRSA, methicillin-resistant Staph aureus, which is an infection that we keep building up a resistance, because sometimes physicians use antibiotics too frequently, and just like with the virus, the bacterial mutations take place that are resistant to the usually prescribed medicine. So now cannabis is being used to treat MRSA, which is a bacterial infection, but we know that cannabis is anti-inflammatory, antibacterial, antifungal.
So it's like you said, what are those called? Like amoxicillin, penicillin.
Those are antibiotics that we use to treat methicillin-resistant Staph aureus. Staph aureus is an infection. Staph aureus is just staph and strep. You've heard of streptococcus. This is staphylococcus.
Yeah.
And it's methicillin-resistant infection, and methicillin-resistant, but it's resistant to vancomycin, It's resistant to so many of the newer drugs. So that's why it's important to use cannabis, because cannabis can control infection, whether bacterial, fungal, or viral. And its ability to prevent further infections from COVID, clearly its antiviral properties have been revealed. So clearly, if it can work that powerful against viruses, which are more difficult to treat, clearly it's going to work against bacteria and fungi, because cannabis strengthens our immune system by being anti-inflammatory, antibacterial, antifungal, and antiviral. So HIV and AIDS is just another inflammatory condition caused by a
bacterial infection,
virus.
Yeah.
So when you talk about infections, bacteria, fungus, and viruses.
Yeah, so that's
that's covered.
So that will qualify you to
Clearly.
bacteria, fungus, infection, virus.
Exactly.
Just like HIV. Okay. Multiple sclerosis. What is that? Multiple sclerosis.
It's a neurological disorder. It's a neurodegenerative disorder where there is damage to the muscles. damage to the nerves. So that's why the muscles get weak. They atrophy, muscle spasms. So, multiple sclerosis is a neurodegenerative disease of the neurons, the cells, and along the nerve pathway from the brain to the to the rest of the body.
So the nerves, they
and
communicate.
Parkinson's the same thing. They're both neurodegenerative disorders, and it's an inflammatory process. The nerves are inflamed for whatever reason, trauma, disease, whatever, and cannabis suppresses the inflammation, and therefore the neuropathy that goes along with those type of illnesses is suppressed. It doesn't cure it, but it improves the quality of life with less muscle spasms, less pain. Tremors are controlled much better. The patient has a better quality of life. They're sleeping better. Their agitation is
It's a
better.
neuroprotectant, so it's
going to help protect.
help in this situation.
Helps protect the nerve, but when the damage is done, you can't reverse that.
Right.
Cannabis slows down.
Slow down multiple sclerosis from getting worse.
As I say to all my patients, cannabis slows down the slow burn that gets us all in the end. And disease is inflammation, period.
Oxidation, yeah.
Oxidative and inflammatory damage. That's why it works for all these various conditions. Neuropathy, we call it.
Yeah. So here we got Crohn's disease. That's more intestinal.
Yeah, we talked about that before. Crohn's disease, ulcerative colitis. It's an autoimmune disease. We are forming antibodies against our own tissues. In the case of Crohn's and ulcerative colitis, it's the intestine. In the case of the bones, it's rheumatoid arthritis. In case of the skin, it's psoriatic arthritis, scleroderma, sarcoidosis, lupus, on and on and on. Those are all inflammatory conditions. They fall under those categories.
So I know Crohn's is kind of like irritable bowel syndrome.
It's another condition. That's a different thing. Irritable bowel syndrome is a nerve imbalance. And cannabis helps. It's inflammation. Everything is inflammation. That's why people with irritable bowel syndrome, it's related to anxiety. And if it's gonna help with anxiety and depression, it's gonna help with inflammatory bowel disease, because it's due to nerve impulses with secondary distress in many cases. And I've seen cannabis work with inflammatory bowel disease, gastritis, reflux, gastroparesis, which is when the stomach doesn't empty properly because of nerve imbalance from diabetes, the neuropathy that we talk about. Cannabis has helped all those patients because it suppresses the inflammation, the neuropathy that goes along with all these diseases that we just mentioned.
And for the digestive system, we have the capsules, which is pretty much where you want to go.
Not just capsules. You gotta use, as we've talked about many times, it's not just capsules.
Topicals over the
topical creams. You want to use at least 3. When you have these kind of conditions, you want to use at least 3 routes consistently, whether it be inhalation, sublingual, topical, or edibles. You gotta find out what route works best to control your symptoms. And as I mentioned before, the patients with ulcerative colitis and Crohn's disease are the most dramatic, because they go from having been on 5 to 10 medications, having 5 to 10 or more bowel movements per day, diarrhea. Now they're at 1 to 2 bowel movements per day, solid food, solid bowel movements rather, and they say the only time they relapse is if they eat fast food. So that tells you what fast food contains. But the point is, cannabis suppresses the inflammation. That's why it works for Crohn's disease and ulcerative colitis and rheumatoid arthritis and all the diseases. So as I said, anybody can qualify for that, because if they don't have these diseases, they must have someone in their family and has a genetic predisposition. And the key is preventive. Cannabis is a preventive medicine as well.
Right. So what we got? Seizures.
we talked
did
about
seizures, epilepsy.
I think we covered everything here, young man.
Anorexia.
That comes under PTSD. That comes under digestive issues. And clearly we know that cannabis, as people describe, can stimulate the munchies.
Yeah, definitely.
So yes, that appetite, that's one of the reasons Marinol was first legalized, to help people with their anorexia when they're getting cancer. So we know cannabis's ability to stimulate the appetite, but THCV suppresses the appetite. So if you want to gain weight, there's one combination. If you want to lose weight, there's another combination, which must include THCV, which suppresses the appetite and is now being studied in weight loss programs.
Yeah, that's cool. And like bulimia is the same type of situation.
All the things. I mean, bulimia, like I said, a lot of this starts in your brain, and cannabis helps us to reach homeostasis, balance. There are receptors in every tissue of our body. So clearly, when there's something wrong with a part of our body, it's inflammation, and cannabis suppresses that. So clearly, it's going to help with over 100 medical and neurological conditions. Cannabis is used and therapeutic. I think we pretty much covered all the qualifications. And as cachexia, that's just cancer. You know, people are suffering from cancer. They lose a lot of weight. They have muscles atrophy.
Just like anorexia.
Cancer, yeah. It's the same thing. You got to stimulate the appetite.
Okay.
The same thing.
And then finally we got spasticity.
That's what was part of when we talked about Parkinson's and multiple sclerosis, because both of them are characterized by muscle weakness, muscle spasms. So muscle spasms will qualify. People that have pain, muscle spasms. That's part of the pathology of Parkinson's and ALS. So clearly, a patient will qualify having just muscle spasms, because cannabis, CBD and THC specifically release pain, release muscle spasms, and is a muscle relaxant.
Wow.
So that alone would qualify that patient.
That's cool. Yeah. So as you can see, you may be able to qualify for medical marijuana. So, give us a call, and we will definitely be able to help you on your path to wellness. All right, Dr. Tamar.
Thank you very much, young man.
I appreciate you.
My pleasure. It's my responsibility.
And you have a great day.
You as well. Thank you, young man.